Okay. Should I introduce myself? Okay, so I'm Dr. Jennifer Thompson. I'm full-time faculty in Indawe here at OUAZ. I'll go ahead and start with the questions. What stages do you explore with adolescent development? So in my class, with adolescent development, we explore several different stages. We look at their growth stage, their physical growth in development, cognitive growth and development, social and psychosocial growth development. We look at ways their brain develops between childhood and adolescent. We look at the differences. We look at their relationships, so the relationships with their parents, with their peers, both in the early childhood stage and how it differs between childhood stage and their adolescent stage. I have them explore the differences between their relationships. I have them look at one relationship with a childhood friend versus a relationship with a friend or girlfriend or boyfriend or partner as an adolescent or later in their teens. What are ways you would treat adolescents in therapy? So there are different ways that you can, if an adolescent were to come to me or to come to any therapist, would look at different treatments. What is obviously suitable for the type of issues that are brought about in a therapy session. So we may look at just maybe role playing. We may look at just talk therapy, maybe just peel back the layers to figure out what are the underlying issues that are causing abnormal behavior or maladaptive behavior, either in a family setting, maybe at school. They might be acting out in school. They might be showing aggressive behavior. So we might take a look at what are the underlying issues. Other ways of exploring those issues, if they are not able to express them directly in therapy, is maybe art therapy or art expression. Maybe doing role playing, as I probably mentioned. For children, it's easier to do sort of sandblocks or play therapy. But role playing, maybe including the family and doing some family sculpting and exploring family dynamics. What does the relationship look like between the adolescent and their parents, the adolescent and their siblings? What is their role in the family? What do you know about adolescents going through trauma at home? How might that have an effect on growth and from early age to childhood, and how does it affect maybe their schoolwork and their social life? I know quite a bit in terms of being a mom, a stepmom, and then also working with adolescents in a therapeutic community home, a group home type setting. My experience has been not just being a mom. I have a 7-year-old, 14-year-old, and a 16-year-old currently, but I also have worked with adolescents, specifically female adolescents who are dealing with post-traumatic stress disorder and substance abuse. So their issues range from just parental abuse to neglect to rape, gang rape, to just substance abuse because they're bored. But a lot of it has underlying issues related to the substance abuse. We have worked on relationships with parents, relationships with siblings, parentified adolescents, where adolescents have actually took on the parental role and took care of their parents. Issues like that. Also issues of neglect and abuse really come prevalent to these females that I've worked with at the group home. So a lot of these issues definitely affect schoolwork, affect educational development, growth development, maturity levels, things like that. How much do parents impact adolescent development? Quite a bit. So I talked a little bit about parental roles. So parentified children are definitely ones who like I said, take on parental roles at an early age. So this is where you might see the child and the parent switch roles, where you might see the child take on house chores, sadly enough, putting their drunk parent to bed, taking out the trash, cooking food for their younger siblings. They might, take their younger siblings to doctor's appointments, take them to school, ensuring that they're doing their homework, that kind of thing. That would be an example of a parentified child. Parents' involvement, I think, in their schoolwork, their use of social media, internet, their school, did I say schoolwork already? Who their friends are, their social life. To a certain degree, you want to have the adolescents start making choices and what to wear and who to hang out with. But we also want to make sure that we are guiding them to make healthy choices. So that would be my, kind of my take on how parents are involved in a healthy way in their adolescents' lives and development. Have you ever counseled somebody who was a victim of depression or suicide? What was the experience like? Absolutely, both in an academic setting and then in a more therapeutic setting. It was very scary. You always want to make sure that your first and foremost concern is the welfare of your client. And so my concern was, do they have a plan in place? Are they really going to do it? Do they have support? So those are the types of questions that I would initially ask, and then go into the root cause, what's going on with them, what is driving them to feel, depression and feel like they want to hurt themselves. Do they have a plan to hurt themselves and hurt somebody else? Because if that's the case, then we want to definitely call the appropriate contact, such as maybe the police. We want to ensure their safety. Okay. Have you ever had to counsel a student with PTSD or other disorders? What was that like? I can't recall. Maybe if they did have symptoms of PTSD, I may not have known. It may not have been apparent at the time. Definitely delivered therapy, facilitated therapy to adolescents with PTSD, and that was my specialty. And part of my internship hours.
I think so, yeah.
The experience was exhausting. It was very tiring. It was something I definitely took home with me, but it's rewarding in the sense that when working with them and giving them the tools to be able to cope, which is basically, that's the essential goal, is you can't take away the substance abuse, you can't take away the trauma they've already experienced, but we can certainly give them guidance in how to cope. So as opposed to using drugs or drinking, we want to be able to say, hey, you know what, maybe go grab a friend and go out for a run, or read a book, or something that will help them deal with the feelings of being lonely, deal with the feelings of feeling inadequate or less than. What are the things that they can do to help them feel better? So those are the types of tools that I would help them with.
Is there anything else you'd like to add?
No, but these are really good questions, and definitely something for those who are looking to work with adolescents or work with, adolescents who experience PTSD. Those are some of the tools that I would help them.
Okay, thank you.
Yeah.